right, guys, welcome back to another episode of Sleep TV. I've got some new guests for us tonight, so I'm excited to introduce the team here and just talk about some different stuff that we haven't brought up on shows in the past. I'm here with my colleague Jeff from Millennium Sleep Lab. We work super close together, and I'll let him talk about what he does in the role as far as AppsMe and everything like that. But also, we've got our guest tonight, Dr. Jackie Demko, and I was looking back. I had to go look it up. I was like, okay, when did I meet her? And it's been a minute. Do you remember when it was? It's been a while. It was
15 years ago.
it was January of 2012. So
Oh,
yeah,
wow.
it's been a little while.
I got to
Uh,
write that down. We have an anniversary.
that's and but it's cool because I think you took one of the courses that was happening back then or something, and then
Yeah.
I remember coming out and visiting your office, and still to this day you had like the coolest marketing I've ever seen for
Oh,
an ortho practice with your like the Humvee thing that you did with the kids. And I was like, that is the smartest idea ever, where they had this cool like wrapped Humvee, like the big military one, not like the
yeah.
the mom and pop version, and they'd like pick the kids up in that, and that must have been like the
Yeah.
coolest thing to go to your ortho appointment in that. Like everybody in town must have wanted to do that. So to this day, that was the best marketing I think I've ever, most creative thing I've seen. That was awesome.
Oh, thanks. We still have it.
You still have it?
We
You
do.
still
It's
do?
not currently running. It needs a new engine because it's a 93 Humvee.
Oh, wow.
Wow,
Yeah.
cool.
And it seats 11 people. It has like stadium seating.
That's very
Really?
Hey, go big or go home.
Where do you keep it?
And now Jim's
Um,
gonna come over. He's not far away. He's gonna come pick it up. So
yeah, yeah.
Yeah.
We built a little shelter behind my Washington office, so it
Okay.
sits back there. Yeah.
that's awesome. Well, sorry, that was like I'm thinking back to the old days, and I'm like, God, that was
Yeah.
a really cool thing. So, um, but also back then you started in sleep, at least with us. Maybe you had, certainly done it prior, but I guess my first thing is, how's that gone? What's that journey been like from back when you first started doing sleep apnea stuff till to where you're at today? And then I'd love to talk about what's happened in the past like year or so with our kind of our new program.
Yeah, the so I started with Dynaflex telling me, hey, you orthodontists manage acrylic. There's no reason you can't be managing these oral appliances. And so they encouraged me to go to that course, which is where I met you. And then as soon as I saw the EcoVision, I was like, it all just made sense to me. I'm like, I don't know how anybody would ever make an oral appliance without using this. And it was like a no-brainer, and the cost was so minimal. So we bought that right away and brought it back to the practice. And any oral appliance, I truly felt I delivered. They talked about titrating and having to go into the sleep clinic and titrate these appliances. I'm like, I'm not having to do that. And patients just loved it. I was nervous about moving away from ortho and getting too much into sleep. You don't want to kind
Mhm.
of, ortho is what I knew. Ortho is,
Of course.
and then let's see, was it 2 years ago? I just felt like, let's revisit this. Let's look at insurance companies and medical because we were trying to do all of our own filing. And so circled back with you guys, got the updated versions, which it's like, oh, wow, okay, a lot has happened over 10 years in terms of the software and what it can do. And then getting us qualified with the medical companies and now the VA, it's night and day. It is probably the most enjoyable part of my practice, which to be honest, I enjoyed it back in the day, back in 2012 also because it's with orthodontics, you straighten teeth. It's a 2 year process. It's enjoyable. But with sleep, they come in next time and they're going, I'm sleeping better. I'm not snoring. My wife and I are sharing a bed together. I mean, people would come in crying, going, you saved my marriage.
That's all.
Or now I love these VA guys. They come in and they go, I'm getting a better result from this than my CPAP. That was something I never expected to ever hear from anybody. And I got to give kudos to your training because as much as we've had Bandy into the office and she's really worked with my sleep coordinator, I mean, these guys are like, they don't want to be on their CPAP because they get better rest on the oral appliance. And it's completely due to the EcoVision.
It's awesome.
It's awesome.
Awesome.
Yeah.
Tell me about the VA thing. I mean, you talked about the VA thing. That's been like a huge push of ours, with APSME, and I'll kind of let Jeff talk about that too, because he's running that side of the program for us, and what I guess, for those of you that don't understand it, or the VA has really emerged in the past few years as being a really big potential, big referral source for dental sleep medicine, because they do pay for oral appliances. They embrace it as an alternative to CPAP. Most VA health systems do not do it in-house. They refer out. But you've got to be part of that club, and that's a tricky thing to get involved in. So, Jeff, can you just speak to what that process is? Like, how does it work for a VA patient, within our network now?
Yeah. So as far as getting into the network, there's a couple different ways that there are things that you have to do to become a VA community care provider, and one of them is to get credentialed with Optum and or TriWest, who's the third party administrator for the VA in different regions around the country. We're already a part of that. So when we credential and sign on one of our providers, it's essentially, since we've done the credentialing, we just add them to our contract and we're able to push it right through. So there's not a long wait time. Typically, like in Optum, you're in an Optum region, Dr. Demko, and it was like 30 days. And what's interesting though is, like you said, we've done a real big push for the VA recently. Actually, we just hired Nadine Mayville, who came from the St. Louis John Cochran VA, and she was with the CCN. She actually handled all the sleep oral appliances and the sleep studies. And so I've noticed, we've been on calls. I mean, it's like night and day talking to the VA, having somebody from the inside that knows what they see and what they do. And so that's been real helpful. But as far as what we're seeing right now, though, is there's still a huge opportunity for VA patients. Like, there are VAs now. St. Louis, we've got a pretty good handle on it. We've got a pretty good program going. I think we've got you've got your 3 locations that are credentialed, which makes it awesome, because basically the way the referrals work for the community care is, first of all, they look at how far you are from the VA facility. They look at, is it in a service that's done within the VA, and St. Louis doesn't have it done within the VA. And then they look at turnaround times, and you guys are awesome. I mean, and I know us as a team, as APSME, they look for us. I mean, I think we get 100% of their referrals right now just because we turn them around so quickly. So the key for the VA is to get them scheduled quickly, see them quickly, and get them back. And I agree with you, Jackie. It is so rewarding. We used to have patients that came into our office, and I actually have a video that I did with one guy. I heard him in the office, and he was talking about how, the same type of thing. I was asleep in in the same room with my wife, and blah blah blah. Now they sleep in the same room, and the guy's training for a marathon. So I mean, it's just like, it was crazy, listening to these stories. So
Yeah.
it's really exciting and really rewarding. We're lucky to have you as part of the program.
And the VA guys are and women, they're so special because they come in, and I feel like when they show up in our office, and I'm sure this is with your other offices too, they're greeted so warmly. It's not like the VA care they're used to receiving through their other clinics. And then they're talked to, they're not rushed through like a number. So it's
Yep.
private care
They say
with
that.
Yeah, yeah, and it's so fun just chatting with them. They tell
Oh,
such
they all have great stories, and they you
yeah,
know and they
That's
and you know
awesome.
when you listen to their CPAP journey,
yeah,
it sounds miserable. You know, they're all miserable, and so
yeah,
it's like they can't believe that this is something, that this was an alternative, that, and you've probably heard it, that they nobody ever told them about. And so, and that's that's the tricky thing, is that it is a first line defense for mild to moderate. You know, according to the VA
yeah,
guidelines, we actually had to send the guidelines to one of the VAs in South Carolina, because they were like, oh yeah, we send out for Inspire and CPAP, and they didn't realize that this was a service. So there's still a ton of education that needs to be done, and it's
yeah.
offices like yours that are out there. I know Blaze is out there, spreading the word, and and talking to these, and so the more we can get involved in I think you've done, or you went did it a community event, or you did a VFW, did
Yeah.
yeah.
And Blaze wants to do more. He's like, how do I? He loves hanging out with those guys.
If they're, it's awesome.
That's great.
Never
Yeah.
not had fun in a VFW.
Right? Yeah. Yeah.
But those kind of events, that's important. Having somebody, and I don't, Dr. Demko, I don't know in your office specifically who that is, or maybe it's Blaze or somebody else, but who's doing that kind of that community outreach, and that kind of going beyond your borders, touching, visiting the potential referring physicians or your existing referrers, or doing the stuff with the VA. Like I get asked a lot, we always preach having like a dedicated full-time, like a full-time employee just for sleep. And, people are like, well, okay, but if I'm only doing two or three, then what are they going to do the rest of the time? I'm like, I can give
Yeah.
them so much stuff to do if you really dedicate them to it, because getting out there is huge. What have you seen for that in your time doing this?
So that was my first reaction at first. Is like, how am I going to pay another person to build something up? But so Sydney is who, so she was a patient coordinator at one of my offices, but she came from the medical side and she was really excited about this. So she literally, we have had to take away her other duties so she could focus on this. And it didn't take but probably 3 months. We doubled each month the past 3 months. And primarily because of the VA stuff. It was like as soon as they knew they could get in quick, their phones were just lighting up.
That's awesome. That is
So,
awesome.
but I almost feel like we need two people because I'm seeing the other ortho patients, and then she's in working with the screening,
Mhm.
but then to be out visiting doctors' offices as well as the VA and circling back because it's not going to just be one time walking into a doctor's office, but I hope that's going to prove more fruitful. Um, because you got to meet you got to meet the receptionist, and then the the doctors, if they're looking for where to send the patients outside of a CPAP, they'll listen. But if they don't care, they're not going to listen. But they don't know who to send to. So as long as you have dropped your name off, that should bear fruit, which we'll see in the next few months
It
more so.
definitely will. It definitely will. I've seen it for years, but you're right. I mean, you're going in there like a specialist, like they're getting courted by, you know, all these specialists, drug reps, they're,
Yeah,
everyone's trying for that time. But I think too, where people have a lot of success is going in to a practice through via a patient, right? So if you have somebody it's already in your chair that you're already taking care of, don't go, cold calling on somebody. Go to their primary care, go to their
yeah,
cardiologist, say, hey, we're working on this person. We're just updating you as to what's going on. And at the very end, it's like, okay, hey, look, we did a great job. They're happy. We helped them. Who else you got? And
yeah,
that's the that's the bait. I had this note here, and just because we don't have a lot of ortho offices, we don't have a lot of orthodontists that are part of this, but I wanted to lean on your expertise there, because this is a question that comes up literally every day of my life for the last 20 years of people, and I'm looking specifically at the general dentists that are sometimes apprehensive to get involved in sleep, or they hear things and they're like worried about something. And one of the things that people are chronically worried about is, well, if I do this, I'm going to change their bite. I'm going to change their teeth. I'm going to move their teeth. I'm going to, somehow create such a detrimental adverse effect with my appliance that it's just going to cause all these problems, and I don't want to. And I always kind of revert back to, well, yes, there's things that things can happen, uh, but also saving their life is kind of important too. That should weigh in your factor somewhere. But what's your take on that? Somebody that is a professional tooth mover. What?
Yeah,
Yeah.
Professional tooth mover.
yeah, yeah.
Right?
I'm glad you asked, and I'm glad I have since 2012. So how many years is that?
It's
13.
13
I'm glad I
years.
have 13 years of experience with these dental appliances to say that has
Right.
only happened once, and
Really?
only once. And that particular woman, it was a little heartbreaking. I did Invisalign, got her teeth perfect. Then it's like, oh, you have sleep apnea. Let's do your holding retainer in the the dorsal. Well, she cranked it asymmetrically. She cranked one side and not the other. So she jimmied it. And so we tried to work to like shift it back. And I never got it quite back where it was when I finished. But to your point, it's like she was alive. She was sleeping. She wasn't snoring and she could eat. Your teeth don't have to touch perfectly to eat. And they were cleansable, so they were straight. So your bite can be a little off, but nobody dies from an imperfect bite. And yes, I'm an orthodontist saying that.
I
Somebody
love that.
studied it, and your teeth only touch 17 minutes of the whole day unless you're a clincher and grinder. And guess who's the biggest clincher and grinder? People with sleep apnea. So if you have an oral appliance in there, you're protecting from that. So literally in that many years, I've only had one person, and that was her. Nobody else has ever had any issues, even with missing condyles, having funny TMJ issues before. I've never had a bite issue like that.
That's
And I'm sure I'm not the only one out there because I'm a good orthodontist, but I'm not the only good orthodontist out there.
sure. No, and I love that feedback. It's amazing because I don't know why that I feel like there's all these weird one in a million horror stories or something that people like go down these rabbit holes and they're like, oh, I just don't want to, and it's like, okay,
Yeah, I think they may be afraid of how the condyle might remodel or whatnot, but for the most
sometimes.
part, you're still passive. And if you're doing it proper, when you're fitting them for the appliance, you're making sure you're not straining the TMJ. I always tell people there's two risk factors with an oral appliance. TMJ getting aggravated. So we're going to review your history, look at your anatomy, make sure you're comfortable as we're working through the bite blocks, and then tooth movement. And I'm not letting that happen because I'm an orthodontist, so I know the lab I use is going to make sure that your appliance is holding you as good as any retainer.
Mhm. I agree, and I think the third thing, and this kind of gets into what you opened with, and how you're doing this clinically, is some of those horror stories I've seen and some of those adverse effects I've seen are ones in cases where the patient was given their little screw and their wrench and say, okay, just crank this until it gets better. And so they go 100 miles forward, way
Yeah.
past any therapeutic endpoint, because that's what they were told to do. And now they're dealing with all the side effects and it's because whoever made it didn't know what they were doing and they just cranked them, to max protrusion and beyond. And I've seen that happen too.
Yeah, yeah, yeah. And I gotta say that's something you guys have helped with a lot too, is helping refine, because obviously you don't want too many office visits, but you want to have enough office visits to properly monitor and service them. And it's really been efficient and effective to deliver it, bring them back at, I think we do 6 to 8 weeks, and then retest them on the EcoVision, and then we do that follow-up sleep test. So we know exactly how many cranks they've done, and we know how that's impacting their airway. And it's not just do it till you feel better. You want both, feel better and get that good measurement.
Right. You got to know where you're going. That's this kind of, you're not just blindly advancing and hoping and praying that they're going to somehow magically get better. You know where you're at. And I think that's important. Yeah.
Well, yeah, and to your point, like it was stunning when I first realized if you advance them too far, you actually do worse for them. So you
Mhm.
have, how do you know, you can't just arbitrarily continue cranking forward. You have to know when you start occluding that airway again. And
Yep.
then as their body's inflammation goes down, maybe it doesn't need to be advanced as far as you thought. So
Absolutely.
those follow-ups are good.
Yep. Definitely. No, I see that a lot. That's all really good pearls and good advice, especially for those new offices. And I always want this content to be valuable for those of you that are considering getting involved in sleep, want to know where to go. Um, that's what we do. And so that's good advice there. Um, gosh, what else is and I'll leave it to for both of you guys. Is there anything else that you feel like that new office needs to hear or know or understand? Somebody that is considering getting involved in sleep, or maybe, you know what, there's actually less of them now than there used to be because there's more people that have dabbled. I run into more people that have done an appliance or two and kind of, dip their toe in the water a little bit than the typical now. In the old days, it used to be nobody had ever done any. Now people have tried. What advice do you have for those folks that want to ramp up their program and want to do more? How do I get to a point where I'm helping all these VA patients and doing this and have a full-time sleep person or multiple full-time sleep people? Um,
I mean, I would say, and you guys could both attest to this, that if you want to do it, you got to go for it. Get into it, get excited, get your whole team excited about it. Don't kind of just look into it. I mean, you could, do your preliminary look in, but once you've made that decision, just go for it. You gotta get what you need. You gotta set up what you need, and you just do the steps and don't hold back. You gotta be enthusiastic and have your team behind you.
Yeah, I agree 100%. And the sleep care coordinator, I think, is one of the most important things, if not the most important thing that an office needs to have, make sure that they establish. That's the person that's gonna drive this program. That's the person that's gonna keep these patients informed. The offices that don't have a dedicated sleep care coordinator, we see it time and time again that the patients don't know what to do. They get confused. I mean, it's a waste of time on all ends when you don't have somebody quarterbacking that program, and it just doesn't work. So, I
Yeah,
mean, that would be my main
that's
takeaway.
that is
And
great advice.
yeah.
That is great advice. I agree. We've preached that for years, and I'm starting to see it happen in a much more widespread basis now, which is huge.
Well, and not just to have a sleep care coordinator, but and have one like Sydney that gets involved, that is out, that is getting involved, or meeting with the regionals on a weekly, if not or biweekly basis. The coaching calls, meeting, getting to know, working closely with their sleep advisors to make sure that the patients go through the process. Even jumping on the telehealth calls. That's one thing that we provide as a service for our clients is we have sleep physicians that are they can do telehealth, and we do the HST and do the follow-ups. But when we have sleep care coordinators jump on the follow-ups, those patients, I mean, it's about 100% closure rate of them going through with the process.
Okay.
And it's because they trust the office, they know the office, they trust, so I really do. If I could tell an office, just the more involved your sleep care coordinator can get, the better. And even to the marketing, stuff. I mean, to get involved and go out there and help with that if they're not seeing patients, maybe that's something that they can do.
Definitely.
yeah,
And
That's
you
great
guys are at
advice.
where you are looking for, trying to get outside referrals and marketing. A lot of practices start out with their own patients, which is hard enough, but then, getting out there, that's a full-time job in itself as well. That's where you said you could use two. You could use one that works with the patients on the inside and one that markets to the physicians and outside referral sources.
yeah.
Definitely.
Hard.
That's really good advice, man. Like I've seen it time and time again. That's a big factor, 100%. So, well, I don't know what time it is when everybody, well, you guys are an hour behind me here. So, or yeah, you're an hour behind me. So we're not too late, but I really appreciate both you guys hopping on and just sharing your story and your time, and Dr. Demko is super cool to catch up because I feel like I've known you a long
Yeah,
time.
thanks,
And
John.
we've talked on the phone and like over email, but not a lot of like face to face. So I will the
Yeah,
next time I'm in town and I'm going to see the Millennium folks, I will absolutely make time to swing up and say hi.
okay, I'll see if I can get that Hummer working by then.
Our, Jeff's gonna come
That
check it
sounds
out. I already
awesome.
know that's happening. So
I got a couple
awesome.
guys here that'll probably work on it for you. So
Awesome.
That'd
Well,
be great.
great.
again, thank you so much for hopping on tonight. Um, and I'll say
Thank
this
you.
to the folks watching and just our industry colleagues too that are watching. If you have something interesting to share, if you're involved in dental sleep medicine, you're involved, with an appliance or product or service or something that would be cool to get out there and just share, let me know. Hop on. We'll get you scheduled for a future chat to catch up because we just, this is all about good info and just getting people up to speed on what we're doing and how this works and hopefully get more offices going. So thank you.
Yeah.